Hi everyone, welcome again to my YouTube channel. Our topic for today is ultrasound in the first trimester. Ultrasound in the first trimester. First trimester ultrasound is often done to assess pregnancy location and thus it overlaps between an obstetric and gynecological ultrasound examination. Accurate performance of an ultrasound examination in the first trimester is important given its ability to confirm an intrauterine gestation, assess viability and number of embryos, and accurately date a pregnancy, all of which are critical for the course of pregnancy. This transvaginal ultrasound of fetus at 12 weeks gestation in a mid-sagittal orientation. Note the high level of resolution which allows for clear depiction of fetal anatomic structures. This is the fetal anatomic structures label. This is the head, the chest, the abdomen, and the extremities of fetus. Main objectives of ultrasound examination in the first trimester. Confirmation of pregnancy. These objectives may differ somewhat based upon the gestational age within the first trimester window, be it 6 weeks, 9 weeks, or 12 weeks, but the main goals are identical. Intrauterine localization of gestational sac. Confirmation of viability, cardiac activity in embryo or fetus. Detection of signs of early pregnancy failure. Chronologic sequence of the landmarks of the first trimester ultrasound in the normal pregnancy will be described and ultrasound findings of pregnancy failure will be presented. Single versus multiple pregnancy or define chronicity in multiples. Furthermore, given the importance of first trimester assignment of chronicity in multiple pregnancies. Assessment of gestational age or pregnancy dating, assessment of normal embryo and gestational sac before 10 weeks, assessment of basic anatomy after 11 weeks. Steps for performance of the transvaginal ultrasound examination. There is general consensus that, with rare exceptions, ultrasound examination in the first trimester of pregnancy should be performed transvaginally. The transvaginal transducer have higher resolution and are positioned closer to the uterus, the gestational sac, and pelvic organs when compared to the abdominal transducer. The patient is informed and consented orally to the performance of transvaginal ultrasound examination. The patient emptied her bladder and is placed in a dorsal lithotomy position or in a supine position with the buttocks elevated by a cushion. Cover sheet is applied to provide pregnancy, and when possible, it is recommended to have a third person or chaperone present in the room in addition to the patient and examiner. Check the transvaginal transducer has been cleaned based upon recommended guidelines, is connected to the machine, and is switched on before you start the examination. Apply gel on the transducer tip, cover with a single-use condom or latex glove, and apply gel on the outside of the condom, paying attention not to create air bubbles below the cover. Insert the transducer gently and angle it inferiorly towards rectum during insertion into vaginal canal as the reduce patient discomfort. Speak with the patient, explain what you are doing, and ask about possible discomfort. Common indication for ultrasound in the first trimester of pregnancy. In many parts of the world, first trimester ultrasound examination is often indication driven, unlike the routine second trimester ultrasound examination that is commonly performed for fetal anatomic assessment. Amenorrhea, or patient does not know she is pregnant, or absence of menstruation, pelvic pain, vaginal bleeding, unknown menstrual dates, subjective feeling of pregnancy, uterus greater or smaller than dates on clinical evaluation, pregnancy tests positive or increased human chorionic gonadotropin values. HCG is a hormones produced by placenta during pregnancy. Nuchal translucency measurement, a measurement thick nuchal thickness or help assess genital problems in embryo or fetus. Sonographic landmarks in the first trimester. The normal intrauterine pregnancy undergoes significant and rapid change in early gestation from a collection of undifferentiated cell to a fetus within a amniotic sac connected to a placenta and a yolk sac. Number one sonographic landmarks in the first trimester is gestational sac. The gestational sac, also referred to as chorionic cavity, is the first sonographic evidence of pregnancy. It is first located slightly paracentrically in the decidua and referred to as the intradecidual sac sign, as a gestational sac is buried in the endometrium. This mid-sagittal plane of uterus showing a gestational sac at 5 weeks. This is the gestational sac. Note the paracentric location of this gestational sac within the decidua. The uterine fundus is labeled for orientation. Mid-sagittal and transverse plane of two uteri showing fluid accumulation between decidual layers. This fluid collection is the decidua has been referred to as pseudosacs, especially in the presence of an ectopic pregnancy. The gestational sac on transvaginal ultrasound appears a few days after menstrual period is missed and is first seen at 4 to 4.5 weeks from the first day of the last menstrual period. The first appearance of a gestational sac on ultrasound may be difficult to visualize but it has rapid growth at about 1 millimeter per day. Sagittal plane of uterus with a gestational sac at 4.5 weeks gestation. Note the echogenic borders. This is the echogenic borders, the arrow of the gestational sac. The echogenic borders ring of gestational sac help to differentiate it from intrauterine fluid or blood collection. When the gestational sac has a mean diameter of 2 to 4 millimeter, its border appears echogenic, which makes its demonstration easy. A mid-sagittal plane of uterus with a gestational sac at 6 weeks gestation. Note the presence of the yolk sac, this labeled, and a small embryo, labeled. The shape of gestational sac is more ellipsoid than circular. A large gestational sac, this image, or mean sac diameter greater than 25 millimeter with no embryo seen. This image is diagnostic of a failed pregnancy. Size, growth, and shape of a gestational sac can vary, and the mean sac diameter is calculated as the arithmetic mean of its greatest sagittal, transverse, and coronal planes. A mean sac diameter cutoff of greater than 25 mm with no embryo is a diagnostic of failed pregnancy. Number 2 is yolk sac. The yolk sac is seen at 5 weeks gestation or menstrual age on transvaginal ultrasound as a small ring within gestational sac with highly echogenic borders. Okay, this image is a mid-sagittal plane of uterus with a gestational sac at 5.5 weeks gestation. Note the yolk sac seen within the gestational sac labeled with highly echogenic borders. Okay, this image is a gestational sac at 6 weeks. Note the location of the embryo labeled. This is the embryo in close proximity to the pre-wall of the yolk sac. This is the yolk sac. Okay, the embryo is attached to the yolk sac by the white line duct. This not seen, the white line duct. The yolk sac and the embryo give the appearance of a diamond engagement ring at this gestation. It is visible at 5 weeks and 5 days gestation. It has a diameter of around 2 mm at 6 weeks and increases slowly to around 6 mm at 12 weeks. The first detection of embryo by ultrasound is noted in close proximity to the pre-wall of the yolk sac, since the yolk sac is connected to the embryo by the bite line duct. Okay, this image is the two gestational sac with abnormal size yolk sac. Small in a, this is the solid arrow, and a large in a large in a broken arrow. Abnormal size of the yolk sac is correlated with a suspicion for an abnormal pregnancy. A small yolk sac with a diameter less than 3 mm between 6 to 10 weeks or a diameter of more than 7 mm before 9 weeks are suspicious for an abnormal pregnancy, and thus this observation requires a follow-up ultrasound examination to assess pregnancy viability. Okay, number three is the ammonion. Amniotic sac develop as a thin echogenic structure surrounding the embryo. The amniotic sac appears following the appearance of the yolk sac and just before the appearance of the embryo, whereas the gestational sac shows variation in size and shape. The growth of the amniotic sac is closely related to that of the embryo between 6 and 10 weeks. Okay, this image is the gestational sac at 7 weeks gestation. The amniotic sac, this labeled, this is the amniotic sac, is seen as a thin reflective circular membrane. The yolk sac and vitelline duct are seen as extra amniotic structures. This is the vitelline duct. Okay, next is the number 4 is the embryo. The embryo is the first seen on transvaginal ultrasound as a focal thickening on top of the yolk sac, giving the appearance of a diamond engagement ring at around the fifth menstrual week. Okay, first cardiac activity should be seen at 6 to 6.5 weeks. Okay, this image is a transvaginal ultrasound of gestational sac with an embryo labeled. This is the embryo, measuring 1.8 millimeter in size. Note the proximal location of the yolk sac is not labeled. You see? To the embryo. The embryo can be recognized by high-resolution transvaginal ultrasound at the 2 to 3 millimeter lens size, but cardiac activity can be consistently seen when the embryo reaches a 5 to 7 millimeter in length or greater. Cardiac rhythm increases rapidly in early gestation, being around 100 to 115 before 6 weeks, rising to 145 to 170 at 8 weeks, and dropping down to plateau of 137 to 144 after 9 weeks gestation. Okay, this image is the gestational sac at 6 weeks with an embryo measuring 5.1 millimeter in crown ramp length. Note the straight shape of the embryo resembling a grain of rice. It's like a grain of rice. The appearance of the embryo on ultrasound changes from 6 weeks to 12 weeks gestation. At 6 weeks gestation, the embryo appears a thin cylinder with no discernible body part. The grain of rice appearance. Okay, next. Okay, this image is a gestational sac with the embryo at 8 weeks. Note the appearance of a body curvature of embryo labeled. Okay, this is embryo labeled, resembling a gummy bear in shape. Gummy bear. It's like a gummy bear in shape. The yolk sac is also labeled. This is the yolk sac. Next image is the gestational sac with an embryo at 10 weeks gestation. Note the clear delineation of the head, chest, abdomen, and extremities. This is the head. This is the chest, the abdomen, and the extremities. As gestational age advances, the embryo develops body curvature and clear delineation on ultrasound of a head, chest, abdomen, extremities, the gummy bear appearance. Okay, next is major fetal malformation that can be diagnosed in early gestation. Anencephaly, exencephaly sequence. Later, I will give you an example of this malformation, this fetal malformation. Okay, a lobar and semi-lobar holoprosencephaly, large encephalocele, Pentalogy of Cantrell, or severe thoraco-abdominal wall defect with ectopia cordis and exomphalos, gastroschisis, large omphalocele, or watch out for possible psychologic herniation of bowel. Limb body wall complex, or also known as body stalk anomaly. Cystic hygroma, gross limb defects. Frank hydrops. Okay, this image is the anencephaly, mid-sagittal view of a fetus at 11 weeks gestation. This is the abnormality shape of the head with absence of cranium. Okay, next image, this one. Coronal view of a fetus at 10 weeks gestation with cystic hygroma. Note the generalized subcutaneous swelling. See, this is subcutaneous swelling. This. Okay, next. Next is this image is a fetus with Pentalogy of Cantrell at 12 weeks gestation. Okay? Note the presence of a large abdominal and chest defect arrow, this arrow, with a protruding cell. Okay, next image. The example of gastrous kisses, this labeled in a fetus at 12 weeks gestation demonstrated in a transverse view of the abdomen. Note the cord insertion labeled. This is the cord insertion to the left of the defect. Okay, that's all for today. I hope you gained some knowledge in this video. Hope you like it. Please like and subscribe for more updates. Thank you, everyone.